So for your awareness, you are being recorded now. Thank you,
Thank you, Erica.
All right, we'll get started. I'm going to share my screen, and I'm not going to work out of that presentation mode that you sometimes see because I won't be able to monitor the chat at the same time. So that's what we're going to do something a little bit different. I tried to size everything up so that you can see what's going on here. All right. As I mentioned, we're going to talk about a new initiative that is just getting started around creating a violence prevention plan for San Antonio and Bexar County. First, as I said, I'm going to take the opportunity to just give you a quick update on what we're doing around domestic violence at Metro Health. As a reminder, Metro Health is your local health department. We serve the city and the county. We have a very long name, but our short nickname is Metro Health. So that's who we're talking about. We are a department of the city, but we do have legal jurisdiction for public health issues in the unincorporated areas of Bexar County. Here's some big picture information about our violence prevention team. We do have 6 areas or 6 teams in this section. I oversee this area. We have 102 personnel, a budget of $10.4 million, which is a mix of city funds and grant funds. And the big portion of that team is our domestic violence prevention program with 59 positions out of the 102. We also have a gun violence intervention program that some of you may know better as Stand Up SA, as in San Antonio. We have a community education team that addresses positive parenting education and training, as well as community outreach and normalizing nonviolent culture and behavior. We also have a data and innovation team that helps us manage our performance monitoring, assessing community data, and using data to work with organizations on identifying risk for violence and resolving those types of issues. And for those of you who participate in the Collaborative Commission on Domestic Violence, we have a position that provides some administrative and logistical support to the CCDV. Additionally, nobody would be complete without administrative support, and we have 6 positions that provide that type of support. I'm going to go ahead and talk a little bit about what we're doing in domestic violence so that you have a sense of where we are today. And this will be a little bit informational for some of you, kind of tell you where we are, and I'll kind of mention a little bit about where we might go from here. So our domestic violence team consists of 59 people. Only 3 of those people do not carry a caseload. So 56 of those people do carry a caseload. Because we transferred the crisis advocate positions that were formerly held at SAPD, focused on family violence, and moved them over to Metro Health, and then we added additional city funds and grant funds to hire more positions, we currently serve clients that we receive through law enforcement related pathways. So anybody identified through SAPD, whether it be a 911 call or a person who makes a report on their own, or a person who walks in or contacts a police substation, they don't have to make a police report. If it is intimate partner violence by nature, or if the situation involves an adult child in the same household as a parent and it's family violence, we provide services to those types of issues. We start with crisis advocate support, and then have an option for long-term case management. I see Anita's hand up. If you can't hear, let me know that. Otherwise, I'll finish the slide real quick and then I'll take your question if that works for you. Yeah, thank you. So for SAPD, a lot of what is working looks the same. A client goes through their interaction with the police department, and then they are contacted by a crisis advocate. Our crisis advocates serve the function of really the kind of one piece of the care continuum of supporting people. And that is addressing those emergency needs, making sure that there's a safety plan in place. Do they have a safe place to stay for the next several days? Are their emergency personal needs met? Do they need food? Do they need clothing? Do they need to obtain identification, get a cell phone, those sorts of things? And that's what the crisis advocates focus on. In the past, they have done some longer term work with certain clients, but we've been able to add a long-term case management function with additional funding. And we're starting a process where we're actually transferring the clients from that short-term kind of emergency care to long-term case management, provided the client is willing to participate in that. I saw a question pop up in the chat, which I will go back and capture as well, and Anita's got her hand up too. So that's kind of how that works. That transfer occurred in October of 2020, and the crisis advocates do actually still work at the police substations. That is where they're seated. They have an office at each of those. They look like civilian employees just as they were before, and they still interact with the police department investigators and officers, but are part of a different organization. And it does afford us the opportunity to use our resources at Metro Health that focus on social service and public health to really amplify that kind of work that they're doing in terms of serving the community. For the benefit of the clients, it creates a little more separation from law enforcement, so that they can feel like there's not necessarily a condition of cooperating with an investigation in order to get those services. But we do, wherever possible and appropriate, interact with law enforcement as we can. Things are different now that these workers are with the health department. The information is not freely exchanged. It is governed by family code, just as it is with many of your organizations. And so client consent is required in order to exchange information with the police department. As many of you know, the sheriff's office, working in a partnership with University Health, STRAC, Family Violence Prevention Services, and others, has kind of stood up a version of this for themselves because they only have 2 victim advocates to cover the entire county for all types of victimization and cases, which is clearly not enough. So we're working together to use our resources to help each other out. STRAC operates a call center that functions 24/7. And when a sheriff's office deputy encounters a person with a situation related to domestic violence, they will call a dedicated navigation line to reach that call center. The call center will help the deputy assess the person that they've encountered, looking for the level of risk for death or near fatal injury. And that helps prioritize the response. Regardless of that priority of response, that information is transmitted to Metro Health, and then we respond and triage kind of based on the severity of the risk. And then we provide the same services that we provide through SAPD for people who come through BCSO. So we basically are kind of serving directly those 2 law enforcement channels. And at this time, we are not serving sort of a general community outreach. We're referring people to family violence prevention services and other organizations. And a lot of that is because we are literally still hiring all of the positions that we have added. We have 4 more to fill in order to have gotten all of them filled at least once. And then, of course, as that goes on, you have a little bit of turnover, and we have to compensate for that. Additionally, we have been putting a lot of work into place to make things more efficient, more effective. And as we get that figured out, we can determine what capacity we have to grow. So we're going to be examining where can we expand, who else can we serve, and where does it make sense. So we definitely want your input on looking for the gaps. I feel like, strategically speaking, if we look for pockets of people or access points where people are struggling to get assistance or service, maybe that's where we need to fill those areas. So think about those things. Long-term case management on our end is unlicensed case management. So while we have social workers on our team, we're not performing a licensed social work service. We are doing lay level case management, which includes updating the safety planning, helping people relocate if they needed, applications for housing and employment, direct enrollment in legal services. When we do have an active contract with Trala, we are able to slide people right into the services and we pay for it, which helps them avoid having to try to find the funds for that. We also refer people to counseling and other types of support services. So that's the kind of snapshot on what's going on with the DV program at Metro Health. So I'll move into the other piece of what we're talking about today. I do need to come back to questions. Give me 1 second because that panel moved away from me and I need to find it. Actually, we'll just go ahead and let somebody chime in. If anybody had a question just on what we've been talking about so far, go ahead and ask your question.
I have a question. Can you hear me?
Yes.
Hi, I'm Velia from San Antonio ISD, and I work alongside many social workers in our district. And as you know, we're inner city. So just for my information, because I have a couple of teams that I coordinate work with directly with our families. And one of them is a domestic violence team. And so I'm not sure, and they're with one of our contractors. I'm not sure if they're aware of all these changes. And I have invited them to this meeting, but they're in the field. So
yeah,
I guess what I'm asking is since we're working directly with our families and parents, more than often it's a crisis that we need to point them in the right direction, but sometimes it isn't. And we catch it way beforehand, and we can work with families on safety plans and things ourselves. But I guess what I'm asking is, when do they call you guys versus going to the substation and working with crisis response?
Great question. We do not create a direct access point for the community right now. The only way to reach us is through the police department or the sheriff's office. Again, though, you don't have to file a report. You can contact a non-emergency line or physically go to a station and say, I'm experiencing domestic violence, I want some help, and they know how to find an advocate. And I think I answered a question in the chat about the physical location of crisis response teams. I see Fernanda's hand up. Anita had a question as well. Anita, do you still have a question?
No, ma'am. You answered it in your discussion. Thank you so much.
Thank you. Fernanda, what's your question?
Hi, my name's Fernanda. I work for WestCare Texas. I'm the community-based crime reduction coordinator. I'm working with a couple of domestic violence nonprofits here locally on the east side, but I'm seeing on here the last bullet point, launching effort to develop violence prevention plan. And I'm working to launch a domestic violence campaign in October, which is the Domestic Violence Awareness Month. The grant that I have is through the Department of Justice, and we are trying to find ways that we can let the community know what's going on by either putting up billboards, putting it in buses. So that's our plan. I don't know if there would be a way for us to partner to kind of help promote the plan. If this is the route that you're trying to go, we have the funding and we just need the partnership. So if there's an opportunity to meet, just please let us know.
Thank you, Fernanda. That's a terrific segue. I'm going to tell you about what this idea is and talk about how to participate and get involved. So I will also present my phone number and email address on the final slide, and I'll put it in the chat so you can copy paste it as well. And that'll be there for you. It looks like we got all the questions there. And of course, you can bring in some more later if you want to. We'll go ahead next and talk about the violence prevention plan. So I started in my current position at Metro Health about 8.5 months ago. And when I began work, being a public health practitioner, I came in and said, what's the need in our community and what should we be doing? And there was already in place a domestic violence strategic plan that was developed in 2019. And it is something that the Collaborative Commission on Domestic Violence has been using as a guide. to addressing things in our community. But there's no larger violence-oriented prevention strategic plan. There also isn't really one spot to go find information about violence in our community and what that looks like, as well as what the need is. So I worked with leadership in the health department and in the city government to ask that we embark on a collaborative effort across the city and county and the whole community to develop a strategic plan that addresses violence prevention, noting that the domestic violence plan was created in 2019 and now it's 2023. And that plan has almost exhausted itself. It's 5 years long and we're getting toward the end. I suggested that we refresh or kind of update and lengthen that domestic violence strategic plan at the same time. The reason for that is because I don't want to create a violence prevention plan without considering how domestic violence plays into that, how it impacts other types of violence, how these things move across. People are often victimized in different ways, and you can't think about it as, well, this is or is not domestic violence, so I'm not going to be concerned about that. So my goal was to really integrate this so that we could be more strategic and collaborative in that effort. And I spoke with the Collaborative Commission on Domestic Violence in December to share this idea, and the group agreed to move forward. So what we're going to do is initiate this process to develop a larger strategic plan around violence that will have a track in it focused on domestic violence. And that way all those kind of domestic violence issues fit there, but whatever else we determine needs to be a focus for the community for the next few years, that will come through in the rest of the plan. So that's the idea behind this. So I'm going to kind of tell you who's working on it and how things are happening. To kind of help formalize this project, I collaborated with some other people in the community to apply for a National Public Health Leadership Academy. Usually those things are kind of a independent process and you just apply on your own. This one is team oriented, and every community that applied had to offer a 4-person team, and it had to represent different sectors of the community. So I applied in partnership with Deputy Chief Chris Benavides at SAPD, Tracy Tate, who's an executive committee member at St. John Baptist Church, and Dr. Kelly Lynch, who's a researcher in intimate partner violence at UTSA in their Department of Criminology and Criminal Justice. And we were accepted to the Leadership Academy. So in addition to the 4 of us as a group going through some virtual training about being leaders in public health issues in our community, we're also have to commit to a leadership project. So our leadership project is developing this violence prevention strategic plan. So that gives us a built-in way to tie some organizations together in partnership on this and have the labor needed to kind of get through the process. So I wanted to introduce these names to you so that you have an awareness that this is the coordinating team and that the 4 of us are working on this together. So I already covered this next slide because I just kind of started talking about things and said that we're going to go ahead and take up a process on behalf of the CCDV to update the domestic violence strategic plan as we develop this bigger plan, but the CCDV involved and steer that track around domestic violence. So I'm going to walk you through now what this process is going to look like and how you can participate. So I know the font's a little bit smaller here, probably. I'll try to walk this through for you. So we're starting right now by getting input from community members, organizations, government agencies, and assembling data available in our community. We're also going to be recruiting people to be involved in the process. In the path of gathering this information, we're going to determine what the priorities should be for the focus of the strategic plan. We know we can't focus on everything because the point of a strategic plan is to pick some areas where we're going to really consolidate our effort. And the whole real value of working collaboratively across the city, the county, nonprofit organizations, the faith community, law enforcement, is to say, if we all figure out what we need to address and we identify the same targets, we can all point the same direction. And if we use our resources collaboratively on the same issues that we're concerned about, we achieve a lot more that way. Right now, all of us compete for resources and money, and we tug against each other in that process. So if we can pick some things we want to work on in the realm of violence, we can really amplify our impact by harnessing those things together. So that's really the effort of the next 2 months, is figuring out what the need is in our community, getting community input, and getting people involved in the process. Starting in March, we'll kick this off, having determined what the priorities will be based on all of this sort of background research that we're doing right now. And we'll spend a few months working together to develop a draft plan. Again, what we'll do is have different tracks of focus or the priority areas, with one of those being domestic violence and the others to be determined based on what we're finding out from community input and from community data. In August, we will share a draft version of the strategic plan with all the pieces together, and we'll look at how the pieces fit, making sure that they align well and cooperate well, and we'll get input from stakeholder organizations and the public, as well as giving opportunities to the government agencies to take a look at and weigh in on it. Go ahead and tidy that up over a couple of months. And work with the CCDV members to specifically develop an implementation plan around the domestic violence track. So that will give them their own roadmap for how and when to implement things around domestic violence. And finally, we will publish the plan in November. So that's the kind of the chronological process. A question people are asking me is, exactly how are you determining the priorities for this and who gets to give some input? So I just want to make sure I explain that well so that people feel like they can communicate that to others. So in the diagram here, in the outer ring, what we see are segments of people who are going to be able to contribute ideas. And I'm going to walk you through it. If we start at the 12 o'clock position on a clock and we go clockwise, like we're going to 1 o'clock, you'll see public input. We're going to create some options for the general public to tell us what they think is important to them around violence and preventing it in our community. Moving down to the green area, we're also going to get government organizations and organizational input, like your own organizations. And we're going to do a little bit of that today, but there will be some other opportunities for getting input from the CCDV members themselves. And I'm sort of leading a parallel process in the city structure for the city departments that have a big role in this, to help them figure out what they want to work on, what's important to them from their viewpoint, and how they're going to contribute to this process. That way, the city is along for the ride and not just kind of watching, but they're involved in that process. If we keep moving clockwise into this light green around 9 o'clock on the clock, we're going to look at organizational data that has been shared. For example, the CCDV issued a statistical report a few months ago. There's a lot of organizational data in that report that explains the type of services that have been provided and to whom. That will be helpful information. We'll also be contacting organizations and looking at people's websites to pick that up. And then finally, looking at classic community data like homicides, calls for service related to family violence, things related to shootings, child abuse. We'll be looking at all that traditional data as well. So as we pool all of this together over the next 2 months, we're going to be able to see what the consensus is around the community's interest, as well as what the data say are the issues that we should be focused on for the next few years. And then that will determine our priorities for the strategic plan. Again, I said domestic violence will definitely be one of the selected priorities because we've made that commitment for the CCDB to help refresh that. And we know in the past few years, we have not completely demolished the problem with domestic violence in our community, right? It persists. We have to keep up the hard work and the collaborative strategic effort on that. So that will be part of that. So what I'm going to do again is pause and take questions. And then we're going to go into an opportunity for you to give some input. So I'm watching the chat. I don't see anything just yet, but you're welcome to add questions. And of course, go ahead and raise your hand and chime in if you have anything to ask. Okay, looking good.
Erica, this is
I didn't
Anita. I have a question about public input. How are you going to go about doing the public input? Is it various meetings or surveys, or how do you expect to do that?
Great. That's a good question. And based on the timeline that we have, in an ideal world, you do a community assessment and you spend several months doing that, and then you do strategic planning. What we're doing right now is a very compressed ramp up to a strategic planning process. So my hope is that working with all of you and other organizations, I would really like to leverage your networks, your client base, the people that you serve and your relationships with them to get that input. That does not necessarily involve me standing in front of the people you work with because they might not want to talk to me or might not want to share that. But I would like to give you some tools to do that so that you could collect that input and then share that back with me. So that can take the form of whatever works for the people that you serve. Because I don't want to be traditionally governmental about the way we do these things, right? Doing it the government way all the time leaves a lot of people out. You create only one way to give feedback and then a lot of people can't participate. So my goal is really to just create sort of a guide around what we want to find out from people and let folks work their magic with everybody they know and that they have relationships with. So I'm going to follow up with an email to the group that says, this is what we're trying to do. Can you help with this? And here's how you can reach me. And this is what it would look like and the time frame. What I would like to do together today, though, is begin by getting your input on things. For those of you who are in the meeting right now, I'm going to initiate some polls in a few minutes that you'll be able to participate in. So you'll want to have your computer handy or your smartphone handy. I'm going to give you a combination of ways to access it. There will be a QR code. There is a link that you can also use, which I'll post in the chat in just a second. And you'll be able to answer the poll questions while we talk about them. And I'm going to share my screen with you so you can see what the results look like. And that will be a way to just begin this process, right? Are there other questions about this?
Is the data gathering going to be done in English and Spanish?
Absolutely. I'm working with a lot of folks who can do it in different ways. I will need help returning it to English when it comes back to me. But by working with community organizations, that's my goal, is we're reaching people in the communication mode that is most appropriate for them. And that's part of the reason I don't want to issue like a single survey that the city hosts, right? Is no matter what you do with one survey, even if it is offered in Spanish, it may not read well to some people. It may not be understandable, may not be physically accessible. So there are a lot of downfalls to having kind of a one way to do it. So that's very much what I would appreciate, is that assistance when I kind of collaborate with everybody, is to get your spin on it. So that it is reachable and makes sense to people in the community. Other questions?
Erica, will you be asking for input, broad input related to domestic violence, or can it be related to people who abuse, adult victims, men, LGBT population, children? So do you want to expand on that?
Yes. I am looking really for the entire big picture. For me, input is different than getting somebody's feedback. Feedback already has boundaries set on it. You know, you're asking for feedback on something that's prescribed already. When I'm asking for your input, it is anything, whatever matters to you as a person. And when we're looking at creating a broader violence prevention plan and addressing broader issues in domestic violence, we have to consider the whole range of issues. You're looking at same-sex relationships. Are we looking at hate crimes that are a type of violence focused on a very specific cause? There are a lot of things going on, elder abuse, situations where an adult child lives in a household with a parent and is routinely abusive, even though that adult parent may be physically able to move around or to leave. They don't have to necessarily be confined to a bed. There are a lot of things we need to consider, and my goal is to open the door completely and let the community tell us what matters to them. Other questions?
You know, we have an event February 14th with the faith community. Would that be a place to gather this kind of data?
That would be perfect. And there's somebody on my team who's helping with the event, Mariana, and she would definitely be able to contribute to that process.
Good.
Yeah, so that's a good way to think about it. If you have some existing ways that you are interacting with folks on a larger scale, I can provide the tools and what we're trying to figure out and ask that you customize it to whatever works for who you're interacting with. Because again, having a city worker show up at a lot of these things is off-putting to people, and people don't necessarily want to share. We're also not doing formal research, so we don't have to adhere to a research protocol. So that gives us the flexibility to do whatever we need to do to get the input.
I had a question. Do you already have a survey? We host community events. I have a community conversation every month. But a lot of the population, like Ms. Patricia had said, is Spanish speaking. I speak Spanish, but are your representatives that you're going to be sending out also going to be speaking Spanish, or are you going to need somebody to be assisting with that?
A little of everything there that you
Okay.
suggested. So we do have some folks on staff who speak Spanish. We have community health workers on our team that we
Okay.
often deploy in that way to get out in the community and get input and share resources, and they speak Spanish. But again, working with all of you, especially in the particular areas you work in, you know the vocabulary, right? You know the words to use to talk about the issues with the people you work with. So that would be very helpful. The polls we're going to do today are kind of an example of the conversations I've been having with people. I see something from Lily in the chat. I'll share that with everybody in just a second. I have kind of a core questions that I'm trying to find out, and I'm modifying them for every audience. So what you'll see here today represents what I'm trying to figure out, but we just kind of tweak it for what we need to do. Lily shared a comment saying she's not trying to be self-serving, but since we as professors at UTSA did that community-wide survey on domestic violence, I hope that will be considered input as well. The piece about involvement of successive generations or generational violence in domestic violence, which crossed racial and ethnic lines, was so important. It seemed like a unique characteristic in our community and was quite concerning. And Lily, that's a good example of existing data, or to kind of use the research nomenclature, secondary data that we're going to go out and capture and pull together. We do want to do some updates in some areas. And of course, when you go to the community, you want to hear the newest thing that's concerning them. So that's why we want to get some fresh information on that, but we will be combing the community for things that already provide that kind of information. Any other questions there? I'm going to go ahead and flip the slide because I'm going to put a link in the chat for you so people can get started. So I am going to go through a couple of polls, and I need to launch it, I think. So let me do that. They just did it. Sure we're sharing the right screen. Are you still seeing a PowerPoint slide? Anybody who's on camera, you can just give me a nod. Yep, okay, good.
Yes.
Perfect. So on the PowerPoint slide, you will see a couple of options for you to access the polls. One is you could type into your computer, menti.com, and then put in this 8-digit code, and that'll take you to the polls. You can use your smartphone to scan that QR code, and that will take you there. Or if you go to the chat, I put in the hyperlink that goes to the poll. So use any of those methods. There are 3 questions. I'm going to give people a minute to start going through them. I'm going to tell you what they're about as you're answering them. The first question is just asking you primarily, how would you describe your affiliation? Are you a service or community organization helping people with domestic violence? Are you an advocate? Do you provide peer support? Do you work in law enforcement, or would you consider yourself in the other group? I was just really thinking about the audience of this meeting when I developed those categories. So that's just going to help me determine who's responding and what that looks like. The second question is asking you to rank priorities around things that need to be addressed in domestic violence. And I know ranking is very hard, right? It's making you make choices. And that's why I asked the question that way. That gives me the opportunity to see what's number 1 for people versus
Sorry,
what's number
Erica.
12.
It's asking, waiting for the presenter to show the next slide.
The next slide, I will do that then. Okay. And then before I move it, to give everybody a chance to respond to this one, the third question will be about bigger issues in violence and what do you think we should be doing in that area. So let me advance this now. Hopefully that will work. Go. So I've seen this platform used before, but I haven't used it myself. So this is our test run today. So make sure you got your question number 1. I'm going to give you a little time with question number 2, which is asking you to rank the most important issues over the next 5 years for domestic violence. I unfortunately couldn't make the font any bigger on there, so hopefully you'll be able to on your end. There are 12 items there. Number 1 is your most important. So number 12 is your least important. So put those in the order that matter to you. And we're going to give folks a minute or 2 to work on that before we launch the next question.
Do you want to put it up again, Erica, please?
Yes, there we go. I was actually going to follow the poll here now so people can see what's happening. So you do have the link for the poll in the chat. If you need that QR code back, let me know and I'll post that again. You do? I'm sorry, Martha.
Yes, thank
Give me
you.
1 second. All right, I'm fighting with the controls here. Give me a second. Okay, there you go, Martha.
Thank you.
So if you had to pop out because of technology issues or you're just joining us, scan this QR code or in the chat, you'll see a hyperlink that will take you to a poll. So I'm giving people a little more time here still to answer this second question. First question was really about who you are and how you're affiliated. I'm going to stop sharing that slide so I can go back to the poll so you can see how it's shaping up. I'm going to spend about another minute here to see what this looks like. So how I prepared this list, I went back, let's see, I'm still on camera. I went back to the 2019 strategic plan and used the gaps and community recommendations that were in this to prepare the list. I also pulled out a few other things that I have been seeing and hearing in the research that I've been doing and used that to create a list. So it's not exhaustive, of course, and you may not be finding the thing that you think is especially important. But this is just a place for us to get started and get some direction. Okay, it's slowing down now. So I am going to shift us to the final question, because we are working on not just domestic violence, but we're looking at violence as a whole. I want to ask you the same question about everything but domestic violence. So here's another list of issues. I'm going to ask you to rank which ones you think are most important for us to address in our community over the next 5 years. And again, number 1 is the most important for you. Give ourselves another minute. People are finishing up, getting through all of the items there and getting those ranked. Okay, I'm going to leave that running and I should be able to go back and show you what this stuff looks like. Give me one moment. So let's take a quick run back to the first slide, which we didn't look at. There we go. So that looks like our results for who is responding to the polls. So whether you function in a domestic violence kind of focused service organization, you're an advocate, peer support, law enforcement, or other. Here's our results related to domestic violence and the most important issues to be addressed over the next 5 years, with the 2 substantially leading ones being coordination between organizations supporting victim survivors And the second one, navigation support for victims and survivors in their journey across the system. Those were the two leading ones with kind of a bit of a gap before the third one. Our final one, other types of violence that we think need to be addressed in our community. There's really a cluster of three, child abuse and neglect as the first, shootings and gun violence, and then sexual violence and abuse as the top three, and then a bit of a gap before the rest. So this is an example of ways I'm getting input. It's not the only way that I'm doing it, but it kind of depends on the setting and the context. I'm going to share that PowerPoint slide again because that has my contact information on it. And as I said, I'm also going to paste that for you in the chat. So let me get that. Yeah, just an example really of how this is working depending on the audience. I'm talking to certain organizations in depth. As I go through a process with the city, I am having to kind of sit with people and have a deeper conversation and say, what does this mean to you? Do I understand it correctly? All of those sorts of things that need to be figured out in the process. I apologize. I'm trying to find my darn controls because every time you share your screen, they move around. I see Patricia is raising her hand. If you want to go ahead, Patricia.
Yeah, I wanted to say that in the chat, Angie Yen from Moms Demand Action asks if there's any efforts at reaching out to all of the school districts in San Antonio and Bexar County, not just, I know Velia is here from SAISD and I'm so glad, but what about all the other school districts?
Good question. We're working on that aspect as well. It's not as easy to kind of jump in and get input from the school districts. I had made a contact with the kind of liaison that we most often work with at Region 20 at the Education Service Center. And he's the person that we typically are working with around violence-related issues and training, which to me made sense as a place to get started from. But I would love any recommendations that people have about reaching out. Of course, Region 20 is only covering the public schools. So there's the aspect of charter and private schools that we need to address, that there've got to be ways to accomplish that as well. I also am working on a public information document, just very basic. This is what we're doing, an email address for people to reach out to, that sort of thing. And as soon as I have that, I'll share that with you. And it's something that you can send to people and give to people. But I also would appreciate any connections alternatively with schools outside of that mainstream kind of connection to make sure that we're getting input in that kind of area.
Okay. To that effect, Patricia, if I may contribute, letters were sent to all of the superintendents in San Antonio, and the response has been tepid and not what we expected. There is the Northside Independent Schools District, which traditionally has been very responsive and has been very ready and accommodating to have discussions around teen dating violence and programming. So I personally chose to continue those conversations with the Northside Independent School District, but still waiting for a more robust response. Of course, and this needs to be said, that the support for schools to have programs in place coming from the government has been dismal, judging by what happened at the last legislative session, where there was no funding offered alongside the bill that ultimately was passed, that offered an opt-in for parents of children to participate in any program related to teen dating violence. So there's a lot of work to be done.
Yeah. Hey, Erica, Lily also posted in the chat that, how do people advance the slide, when they go onto that Menti website?
It's looking like, I'm looking at the time, so it's been several minutes since that. Lily, let me know if you weren't able to get things going in there. I will launch that again. I just won't share the screen while I do it. And that hopefully will take care of that issue. So
I see. Okay,
Yeah, I
good.
think she posted it before you had
yeah,
changed.
I think it was probably, but just
Okay.
in case my being inside the poll has something to do with that, I'll just keep that opened up.
Okay.
Okay, and Lily says it advanced when I advanced. Okay. So there's a setting there that I can adjust in the future.
Awesome.
Other
So,
questions? Go ahead, Julie.
well, Erica, I was just going to say, we can, even though you won't be back and presenting it at every meeting that we have, I think Marta, Patricia, and I can keep everybody apprised of what is going on, kind of where you are, what the results are, and kind of the next steps, because I'm sure everyone here will be very interested.
Yes. And what should people do if the things that they think about were not mentioned on the list? How do we pass that information along?
For you folks here right now, go ahead and send that to me through my contact information. If you are kind of acting as an extension of this effort and collecting that, we don't have to put a list in front of people necessarily. I did that because of the size of this group and the fact that it's virtual. But you can leave it open and just say, tell me the things that matter to you. And then what I'm doing when I do that is kind of funneling it down then and getting people to kind of come to an agreement on the most important of those things. So there are options there to kind of handle that however you think is appropriate. But yeah, if you had other things to share today, you go ahead and send that back to me and I'll add it into my notes to go with the polls from today.
Good. Thank you.
But Patricia, there is a question from Velia Aguillon before Julia closes. Velia's asking, so then the SAPD crisis response teams are no longer at the substations? Erica, do you want to answer that for Velia?
We did answer that earlier on, I think, and just said that, yes, those advocates do still work at the substations. They just work for the health department and they're co-located with the police department.
And also, Erica, where will the recording be posted? That was another question in the chat.
I will see if I can send it as an email link. I'll figure something out so that everybody can get that in the most effective way possible. There's a question too about when a survey will be available for the public. So just a reminder, rather than doing a single survey for the masses, we're really taking a grassroots kind of approach for two reasons. One, we can do it in a shorter timeline. And two, we can customize it to the people that we're trying to reach and hopefully get more representative.
Can you go back to your timeline, Erica, just so I can see?
You bet.
And then can you send us this presentation as well?
Absolutely.
Hey, Erica, before last year, the recordings used to be posted on the ccdv.org website, just as a heads up.
Okay, so we'll let everybody know where it is if Erica doesn't email us directly. Sound good? Okay, good. Well, it's 1 o'clock. I know everyone has spent an hour with us, and we appreciate that. Thank you, Erica, very much for coming and talking to us about what is going on. Everyone, please contact Erica, send her information so that we can get a really good plan for the city. Patricia, your hand is raised.
No. Just thank you, everybody. Let's get as much input as we can in. Thank you. Bye.
Yes.
Great day.
Thank you,
Thank
everybody.
you. Thank you, Julia, Patricia, Erica, everybody. Thank you very much.
Thank you. Bye.
Adios.